Kutscher is an associate professor of pharmacy practice at South Dakota State University. His specialty is psychopharmacology, and he says the use of psychotropic medication is not a one-size-fits-all proposition.
The old adage of kids are just little adults isn't always true. Oftentimes in kids they actually require more medications. Depending on the illness, sometimes their metabolism is faster, so they'll take more medications. I tell people to think about it just as you would the elderly people. When you give a geriatric person a medication, they require a different dosing than, say, someone that's younger. In the same way with kids, they don't always require the same.
Kutscher says some studies have noted differences in the reported side effects of psychotropic medications in kids and adults. In particular, medications used to treat depression made the news because of an increase in reported thoughts of suicide in children and adolescents taking these drugs. This led the Food and Drug Administration to place a black box warning on these medications, but the reports that led to this action are somewhat controversial.
Is it different than kids and adults? You know, there is it's more reported in kids, upwards of, say, like 24 years, if you want to call that a kid, but it seems to not be as reported often in adults. Now, I think some of that could just be how the studies are designed. In adults, they really select out people that have any suicidal thoughts ever, and maybe kids just don't report that as much, and they don't really select those kids out in the study, so it could be why it's coming out. There's 3 or 4 theories on if it's really any different or if it's just how the studies were conducted.
Kutscher teaches his students that it's crucial for the parents and caregivers of children who have been prescribed psychiatric medications to quiz their doctors and pharmacists about the impact of these drugs.
Yeah, I think parents should just, if they're getting a medication for their child, they should ask lots of questions up front. Okay, what are we using this for? What do you expect to improve? What symptoms should I watch to improve? Talk to the provider about that.
And Kutscher also stresses that therapy, not just pills, should be considered when treating mental illness in children.
And I promote psychotherapy a lot because if you look at studies, it's always included with drugs. They always are making sure people are doing those things. And then when it comes to the real world, it's here's your medication, have a good day. And they sort of forget a big part of it that needs to be included.
Reporting from South Dakota State University, I'm Tammy Watson.